I'm Diane Markham. I'm the Marketing and Communications Manager at Arbor Health, and I want to welcome you to one of our sessions for Wellness Week. We're excited that this was our first year of having Wellness Week. Although the pandemic certainly changed our plans, we're excited to be able to do these virtual sessions. This session will be recorded and will be added to our website in the near future. And I want to introduce Bryan Gettys. He's here to talk about aging and exercise. So Bryan, I'll actually let you go ahead and introduce yourself.
Okay, thank you, Diane. And just welcome everybody to the presentation. I'm super excited about it. I just wanted to give you a brief introduction of who I am and why I'm giving the presentation. But first off, my name is Bryan Gettys, and I am a doctor of physical therapy. And for those of you who don't know what a physical therapist is we are healthcare professionals who are movement experts and help people throughout the recovery process from disease, injury, or surgery. I'm currently a staff physical therapist at Arbor Health Morton Hospital, and I specialize in outpatient orthopedics, sports injury, total joint replacements, and other orthopedic recovery or management. But for the purpose of this presentation, I also have an interest in age-related changes and how those affect our life throughout our lifespan. And I'm excited to have this opportunity to shed some insight on some of the things that happen to our bodies naturally through being human and what things we can do to maintain a healthy lifestyle. All right, so I'd like to go over the objectives with all of you, and by the time the lecture is over, my goals are to educate you on some of the ways our body changes over time throughout the experience of aging, some common conditions that happen in our later years, and ways to encourage a healthy lifestyle needed to continue to enjoy the activities and hobbies you engage in and can continue them throughout your whole life. So basically, as humans, we are finite beings, and biology starts to break down and cellular death eventually happens. We are also living longer than ever. We have had an increase in longevity since the 1980s, where the average lifespan was approximately 74 years old. And now our life expectancy is around 78. So we've gained a couple of years, likely due to medical advancements, technologies, and pharmaceuticals. So I think in general, our goals are to be happy and enjoy the passions and activities and people we love, because I think the most valuable thing we have in life is time. And we need to choose what type of quality of life we want in order to have the best quality of life we can. So the next slides discuss life development and some key physical changes that typically begin in our 30s and beyond. And that's going to be a common theme in our lecture is we're more focused, the first part of the first few decades are development, and then after our 30s, we begin to see those changes. And so aging has an effect on all aspects of our body, health, and how we progress into our future decades. So I just want to give a visual representation of years of life associated with the categories of our lifespan. So if you look at the slide here, it's birth to 1, you're considered an infant. From 2 to 4, you're a toddler. From 5 to 12, you're a child. And 13 to 19 are those crazy teenage years. And from 20 to 39, that's kind of where we're going to start our discussion. And then we're primarily going to focus on, that 40 to 59, which is middle adult, and 60 plus, which is called a senior adult. And I do believe that 60 plus even has categories in and of itself, but for the sake of our time together, 60 plus is just going to be a senior adult. So again, we are primarily going to focus on what happens to the body after the age of 30 and beyond, because at 30 years old, we typically stop developing and those degenerative changes begin to happen in the body with further progression into our future decades. So one key component to aging is the concept of sarcopenia. And I know that's a big word, but sarcopenia is a term given to define the physical changes that happen throughout the progression of life, typically associated with reduction of metabolic, cellular, and physical function. So here's that big word, it's sarcopenia, and that just means a progressive loss of skeletal muscle mass and strength. correlated with physical disability and poor quality of life, generally in those later years. And there's a bunch of risk factors such as age, gender, and the big one, and we're going to hit more on this, is your activity levels. Like, are you a sedentary person? Do you sit on the couch and you're not very engaged in many things? Or are you an active person and do you exercise, and what that effect has on your body? So lifespan development after early adulthood quickly peaks, and most tissue function declines with advanced aging, which may lead to increased risk factors for things like cancers, heart disease, and reduction in overall quality of life. So next, we are going to look at the different systems and how they are affected over time as we age. The first system we're going to take a look at is the musculoskeletal system. And that's just a big fancy word that means that the musculoskeletal system is comprised of bones, muscles, tendons, and ligaments, and all those are responsible for body movement and function. And again, at around age 30 years old, the body begins to naturally decline in muscle mass, testosterone, which is in all genders, not just men, power, muscle strength, body composition, decreased elasticity, and tissue can become fibrotic. And fibrosis just means thickened, hardened tissue that loses its ability to stretch with movement. So basically, we get stiffer and less pliable as we age. These ages have an effect on mobility, walking, and movement throughout the back, arms, and legs. But when we talk about those fibrotic changes, it not only happens in the musculoskeletal system, but it also happens in the cardiovascular system, which involves your heart, your lungs, your arteries, and your veins. And that's what we're going to talk about next. So again, as we age, we're at an increased risk for vascular disease. It increases remarkably. We have higher blood pressures and increased heart rate. So that's very important because the heart is very important for overall health. Because later in life, 22% of men and 34% of women ages 65 to 74 years of age are hypertensive, and those numbers are pretty high, 22 to 34%. That means you have the potential to have a lower oxygen carrying capacity, and that may lead to conditions such as high blood pressure, something called cardiac heart failure, heart attacks, or potentially strokes. So next, we're going to look at the central nervous system, or the brain. The brain and the sensory system, and what I mean by sensory system is how the body reacts to the world and the environment. And our motor control is what our brains tells our muscles to do. So it's that communication that we have that, we can turn on a dime, sprint, do a backflip. That's not the case later in life. So in aging adults, it can result from a variety of factors such as neurological changes that affect reaction speed, strength, balance, motor control, and coordination, and all these have an effect on daily living. So here, if we look back to the slides, again, with the pattern of aging, we have a slowed system response time, decreased motor recruitment, and vestibular disturbances and decreased sensation. So I want to target that word vestibular. So the vestibular system is just how your brain interprets your body position in space relative to the environment. And that can influence falls, social engagement, activity participation, and potentially independence. So very, very important. And again, this happens later in the later stages of life, and balance being a major factor on the influence of fall risk and controlled walking. So all systems in the body are affected by age-related changes. However, for our focus, we're just going to look at the musculoskeletal, the cardiovascular, and the neurological system, because our focus is mobility and activity tolerance throughout the lifespan, and these three components are some of the greatest influences. Okay, So sedentary lifestyle. Sedentary lifestyle is a term just used for people that do a lot of sitting down, laying down, either don't want to do physical activities or don't have the energy to do physical activity. And this is kind of a dangerous cycle because, you know, the less we do, the less activity we do, then the less tolerance we have for that activity. And you can see if that cycle continues, it would not be good. So another interesting fact is that individuals who participate in a sedentary lifestyle, their energy expenditure or how they use their energy declines by about 15% between the third and fourth decade of life. And if this trend continues throughout the life, this causes an unbalanced effect on energy needs with appropriate intake or nutrition, ultimately resulting in increased body fat. So if you're not paying attention to nutrition and intake amount and not using the stored energy received from the food you eat, this imbalance has the potential to lead to things like diabetes, obesity, and deconditioning. Which leads me to an interesting study that was recently done reviewing the role of exercise in elderly adults over a 3-year period and compared to leisurely activities or low intensity exercises versus higher level activities or higher level exercises. And basically, it shows that those individuals that participated in those higher level exercises or activities had an increase in muscle mass, less fat, and higher potassium levels. And I find this study particularly important because in my profession, I spend a fair amount of time explaining the difference between activity participation versus structured specific exercises targeting certain muscle groups needed to be strong and healthy in order for a person to continue with the activities they enjoy, such as hiking or walking or gardening, and reduce the chance of injury, soreness, and pain, you know, after that activity, so they can continue to engage in that. So back to the slide, this, you know, the sedentary lifestyle can increase your risk of metabolic syndrome, decreases your muscle mass, poor cardiovascular fitness, deconditioning, can lead to a lower quality of life and sleep disturbances. So the next slide I have in here, I just kind of threw it in because I just think it's such a great resource. So the NIA is the National Institute on Aging. And if you click on that link, I would urge you to do so. They've got a lot of resources out there, and especially the strategic direction on where the US is doing some of the research into aging, you know, senior living and that kind of thing, and what factors affect the quality of life into your later years. So I definitely would recommend taking a look at that. And also the CDC has some interesting information regarding productive aging and engaging in work, continuing to challenge the mind and participate in activities. It's very interesting. And again, I would encourage you to click the links and take a look at the information provided, because I do think it has some great resources for people to explore. Next, we will take a look at some changes that happen in the body regarding our joints and some common injuries that happen later in life or increase our chances, risks for having some of these issues. All right, so here is an anatomy of a joint. And so basically you have synovial fluid, which lubricates the joint. Then you have cartilage that connects to the bones here, and then which accounts for smooth movement in a joint. And then the things here on the side are ligaments, and ligaments help with stability. So all very important factors to the joint. And in the next couple slides, we're going to kind of see the progression of changes as we age. So in joints, there can be thinning of cartilage surrounding the articular bone. So again, if I go back to here, that's that thinning space here, and that's responsible for smooth movement. So if that thins, then you know, you're not going to have smooth movement. So another thing is inflammation of the synovial fluid, that lubrication of the joint. It can become painful if it has a chronic inflammation. And then decreased flexibility in surrounding capsule ligament structures. So what I was just saying was you have the ligaments on the side of the joint, and earlier we talked about fibrotic changes and elasticity, and basically later in life, our joints can can become stiff and tight and potentially painful. So if that happens, then arthritis might happen. And arthritis is another common condition seen throughout our lifetime. It can be caused naturally or with repetitive kind of micro trauma or little damage to the area continuously, or an injury sustained throughout the area. It can become more progressive if untreated, and continuation of repeated use and strain to the area. On the next slide, we'll see the progression of arthritic changes that may lead to osteoarthritis. So I like this slide because it shows an x-ray of knees, and you can kind of see the one on the left and the spacing in between the knee joint there. It's good, it's healthy. You can kind of see the back space of the joint there. But if you look on the right side, you can kind of see osteoarthritis where the cartilage is worn away, the bone tissue begins to compress, and it can become, pretty painful. Excuse me. I think that's what's known as when a doctor, a physician, or your primary care may suggest that you have a bone on bone, which is another kind of generic term for osteoarthritis. Excuse me. So it can be painful. You may need to seek conservative treatment at first, and potentially, if recommended by an orthopedic surgeon, they may think that you're a good candidate for a total joint replacement. And if they do, they're doing this, they're looking to decrease your daily pain, and more importantly, they're trying to improve your function. Another common condition is osteoporosis. Osteoporosis is loss in bone density. And what that means is a loss of calcium that forms in the inner foundations of the bone. And this happens in both men and women, however, is more common in women. And again, you may need to seek conservative treatment, such as weight-bearing activities or exercise, or medication management to reduce the progression of osteoporosis. Hip fractures are another common injury seen in individuals over the age of 65 years old due to loss of balance, resulting in a fall and potentially fracturing different areas of the hip. I kind of like this picture because it shows you those little red marks are common areas where the hip can be fractured from a fall. This happens because of age-related changes and overall reduction in sensory information, or what your brain, the feedback from its environment, reaction speed, and balance. So balance is a very, very important factor when we age, and should continue to challenge our balance system in order to improve those proactive and reactive balance, our limits of stability, and our ability to recover from like a trip or a stumble. Again, like in our early 30s, I was a big soccer player, and if someone came up behind me and kicked one leg out, I could still kind of catch my balance. I'm 35 now. I probably have a little bit more of a challenge trying to recover from that. But again, if we were to do that to someone later in life, I think they would have a little bit of more of a challenge, just because they have that decreased sensory response, reaction speed, and then reactive balance. So continuing on, these are just some other conditions that happen throughout our life. Sprain is a small tear in ligamentous fiber. A strain is a small tear in muscle fibers. And bursitis. Bursitis is swelling of lubricated joints. So there's many, many more. I just chose a few to kind of go over, just some of the more common ones that I've seen. So I really like this graph, because when we talk about health and quality of life, this slide is a visual demonstration representing changes in our body and health as we age. And the point of this slide is to encourage activity to combat and lessen some of the natural decline in aging. This is not, absolute. This is not finite. It depends on a lot of different factors such as genetics, activity, resources, and means. But I'll take you back to the slide. And as you can see, from 0 to 30, we're continuing to develop, and there's not a lot of, degenerative changes happening in the body. But right about just after our 30s and into our 40s, we kind of see that big uptick. So that's when we see kind of the first set of changes where you're like, oh man, my shoulder isn't moving as well as it once did. It's because there's changes happening in the body. And so if we continue from 40s to 55, it kind of tapers off a little bit, but you see that little incline. And then the end from 60 and above, that's when those changes really begin to spike at our last few decades of life. We'll have to pay attention to this chart in order to prepare ourselves for the future. So in our 40s, progressing to our 50s, approaching to our 60s, in order to promote health and wellness. I think this is a great chart. So the next slides, we're going to look at the different type of exercises available to us and how they can combat aging and promote increased health. So general exercise has numerous health benefits throughout the body and their systems. So basically, our body wants to move, and by adding a little resistance with sets and reps, humans increase strength and endurance needed to combat disease and promote functional mobility. So there are many supporting research articles discussing aging and exercises out there, and I would encourage you not only to take my word for it, but there is so much research promoting aerobic exercise, strength training exercises, yoga, tai chi, all different types of things that can have positive benefits to the body. And we're going to talk about those in a minute. But yeah, I mean, the internet and technology, it's a great resource. So this is a pretty popular cross-sectional MRI. So what they did was they took 3 different people, and they kind of, this is an image that they pretty much cut their leg off, and we can see the quality of tissue in here. And the very interesting thing is the top and the bottom images. The bottom image is that of a 70-year-old triathlete, and triathlete's a very high-level athlete, but this still gives you some perspective on the differences of quality of tissue and kind of the similarities between a 40-year-old and a 70-year-old, a healthy 70-year-old. And when compared to that middle image, you see that 74-year-old who lives a sedentary lifestyle, that yellow material surrounding the muscle is fat. So, the more active individual later in life has really good lean muscle mass, which is great and is a sign of healthy tissue. So I would imagine that if you compare these 2 individuals side by side, you would see a pretty drastic difference in their activity tolerance and their ability to participate in hobbies and gardening and hiking and things like this. But yeah, very interesting in regards to those 3 different perspectives. But next, we're going to look at the specific parameters and the recommendations on what type of exercises are out there and how sets and repetitions or time you should be completing. So at first, we're going to look at strength training. I feel like most people know what kind of strength training is. It's basically moving our arms and our legs against resistance, and our body likes that. It responds great by breaking down muscles to build them back up again, and that's kind of what muscle performance and strength is. So usually it's recommended to do that 2 times a week, 2 to 3 sets, and 8 reps. So when I think of sets and reps, I'm just kind of thinking of, I don't know, like a theater, a play or something, where if there are, 3 acts to the play, 1, 2, 3. So in the first act, you would do 8 to 10 reps. And in the second act, you would do 8 to 10 reps. And the third act, you would do 8 to 10 reps for that specific exercise, and then move on to something different. And you're really trying to target those major muscle groups, all, for your arms, whole body, back, and legs. And the last rep should be rather challenging or a little bit difficult to do. And strength training is the most effective strategy to combat sarcopenia, that term that we were talking about earlier. It can improve that lean body mass. And again, that lean body mass is that beautiful muscles that we see here as compared to the sedentary lifestyle. And it can help manage, treat depression, arthritis, low back pain, more. It also releases endorphins, which are chemicals in the brain when we exercise, which is generally more happy and positive brain function that has carryover to our daily lives. So cardiovascular training is also known as aerobic training. And the CDC recommends about 30 to 60 minutes a day to moderate to high intensity cardiovascular training or aerobic training, approximately 5 days a week. And I'm going to give examples later in the lecture on what type of activities qualify for moderate or higher intensity. But for this example, right underneath the slide, walking, biking, aquatic therapy, things like that. And there's just so many benefits to that. Improve cardiovascular endurance, improve heart health, which we talked is so important, improve muscle endurance, improve bone health, and improve glycemic control. And if you can't, the 30 and 60 is a recommendation. I think it's a goal to work up to. If you can only do 10 minutes a day, there's no kind of standard on where to start. I think just starting is the key. So if you have, 5 minutes, 10 minutes, 20 minutes is fantastic, but the goal is to work up to 30 minutes and above in one session. A new term that is relatively new is high intensity interval training. And this is interesting because it's an intense bout of exercise followed by a period of active recovery, optimizing training while decreasing time of training. So this is a way to reduce the amount of rest breaks and promote continuous movements in order to reduce the amount of time or training exercises and still make gains and benefits, because it's a combination of aerobic. Aerobic, we're just thinking of continuous movement. And then anaerobic just means if you're doing an exercises and you're standing in the same spot, basically. And these benefits are, it lowers your blood pressure, improve insulin sensitivity, overall decrease body fat, increase muscle tone, and big one, increased activity tolerance. Next, Tai Chi. So Tai Chi works to improve balance and challenge stability throughout controlled movements and breathing. It's an ancient Chinese tradition, but today it's very commonly adopted in the Western culture. But the benefits there are improved balance and reduce fall risks. Again, age-related changes like we talked about. As we age, we have a natural increase in fall risk. So this can help combat that. Decrease stress levels, improve brain function, and improve flexibility. Again, flexibility relating to those earlier slides when we talked about those fibrotic changes or the ability to have your tissues stretch and then recover is lessened. So yoga, I feel like most people know what yoga is, but yoga is a series of movements and stretches and positional holds that encourage awareness through breathing. It's really great for mobility, range of motion, stretching muscles. So it also enhances muscle strength, improves mobility, and reduces stress, anxiety, and depression. And I think that's mainly due to the breathing component. It helps you control your breath and help you moderate your breathing that way. So again, aerobic exercise there's a lot of evidence that your aerobic capacity is a significant prediction of your future health. So if you have good aerobic capacity and you're working on things like aerobic exercise, then it's a wonderful prediction of how you're going to fare into those later years. So some examples of aerobic exercises for the moderate section is power walking, water aerobics, doubles tennis, and ballroom dancing, if that is something that you're interested in. So some of the more vigorous or higher level activities would be race walking, lap swimming, aerobic dancing, and jumping rope. So it begins with you. Everybody knows exercise is good for you, but not everyone has the time or resources to engage in preventative activities. There has been growing research on psychological factors and how they influence a person's ability to participate in exercise. I would again encourage you to look at the link by the NIA or the National Institute on Aging and see where that research is headed. But there are so many resources out there right now in regards to all different types of exercises. But you could search the internet, some websites, YouTube, look at videos. reach out to a senior center or other group exercise classes that combine some of these different types of exercises we went over, or you could speak to a physical therapist who could set up an exercise program specific to your goals and needs. So that's going to wrap up my time, and I appreciate everyone who participated in the presentation. And if anybody has any questions, feel free to ask.
Thank you, Bryan. That was some really good information. I know I learned a lot. One thing I'll comment on, then I'll ask if anybody has questions, that I appreciated what you talked about, people who are not currently exercising to just start.
Yeah.
And not be dismayed by that 30 to 60 minute goal. So that's what I'm gonna take away from it, is that I just need to start. So
yeah, absolutely. And I know for me, it really helps to have like an accountability partner. So if you have like an exercise partner, a walking partner, a running partner, that really helps. Because if you're like, hey, I'm going to wake up at 8 o'clock and meet you here, and I know this person, the alarm goes off, you're a little bit, you're like, oh, I'm so tired. But when you have that accountability partner, that kind of motivates you to have that accountability with that person. So
you wouldn't want to just sleep in and leave them standing on the corner. So yeah.
Sure. Yeah. I mean,
Yeah.
I'm just as guilty.
Yeah. Does anyone else have any questions for Bryan? And you don't have to put your camera on. You can just put your audio or voice if you want.
No, I really appreciated this. Thank you for doing that. It gives me some helpful tips for my patients too.
Right on.
Great. All right. Well, thank you very much, Bryan. And like I said earlier, this will be on the website very soon.
Fantastic. All right. See you guys.
Bye-bye.